Within Chapter 13, we will expand upon some of the information in the previous chapter by focusing on professional EMS organizations. Once completed with this presentation, you should be able to identify key standards written by organizations and explain how they apply to an EMS agency. Understand the importance of such professional organizations in general and for EMS in particular. Identify the professional organizations that play a role in the EMS field and describe what role each organization has. Determine which professional organizations serve the needs of your particular EMS agency. Differentiate between a professional organization, trade association, and accrediting agency. And gain a general understanding of EMS accreditation and the steps EMS organizations must take to achieve accredited status. Imagine for a moment that you are not a seasoned EMS provider and that you are a recent graduate from a local EMS program who is just hired by an EMS agency. You want to develop your career as an EMS provider and remember hearing about professional EMS associations and trade groups. Why should you consider joining a professional association or trade group? Why would your participation be important? What professional associations or trade groups should you join, assuming you are considering more than just one? This presentation should hopefully provide some guidance for the EMS professional looking to answer these questions for him or herself. Professional organizations are formed when members of a certain profession organize to pursue some mutual goal. The goals associated with professional organizations typically include providing continuing education and networking, promoting the image of the profession, establishing certification or licensing standards, applying a code of ethics, protecting the public, advancing research, and fostering professional standards. Given these efforts, membership in professional organizations and trade associations can give an EMS provider a wide range of tools to become better at his or her job. Professional organizations associated with trade associations may engage in advocacy, political action, and accreditation to better serve the interests of their respective professions. To begin, professional organizations typically need money to ensure viability. Those lofty goals we just mentioned a couple slides ago typically come at a price. While some organizations are able to sustain themselves through volunteers and donations, many professional organizations must generate revenue to pay staff, generate deliverables, and participate in political action. The primary funding mechanism for many professional organizations is to charge membership fees for those who want to join and reap the benefits of being associated with the organization. The cost of such memberships can vary considerably depending on the organization. For someone looking to join a professional organization, it is important to first know what he or she wants from the organization and determine if the organization being considered can provide those services. There are many reasons why someone would join a professional organization, such as the opportunity for networking, being able to benchmark against other similar professionals, individual or professional growth, continuing education, advocacy in the political or legislative arena, discounts on professional supplies, or to increase the strength of a resume. Networking within a professional organization commonly gives the individual an opportunity to connect with other like-minded professionals across a much broader geographical region. This networking enhances the EMS provider's knowledge of the field while allowing the provider to establish important relationships with other EMS professionals. This networking can occur through organizational blogs, online forums, conference calls, meetings, conferences, and conventions. It has been said it is not often what you know, but who you know. Networking through a professional organization gives an EMS provider the opportunity to expand his or her personal sphere of influence within the profession, which can pay dividends later when looking for a new job or trying to move an important initiative through the political process. Many professional organizations collect data from their members or other profession-related sources. When compiled and shared with its members, it is possible for EMS agencies or its members to compare themselves to others within the profession for the purposes of benchmarking. Are your response times good or bad? Maybe there is a benchmark report available through a professional organization that establishes an average or a standard based upon a statistical analysis of that data. Do you think you are making enough money with your current employer? There may be data available through your professional organization that allows you to see what others are making in similar positions at other agencies. Professional organizations may publish newsletters or magazines, they send emails, update social network feeds, or sponsor a blog or wiki for the sharing of emerging trends, standards, and ideas. These various resources serve as the basis for presenting new information, questioning old habits, and ultimately growing as a professional by expanding one's knowledge base. Whether through these mechanisms or others, such as conferences, symposiums, or online continuing education opportunities, professional organizations can assist EMS professionals in learning about new procedures and adjusting their skill set or perspective to incorporate new ideas in the practice of pre-hospital medicine. Higher level education can obviously help the development of an EMS provider, and membership in a professional organization may assist in pursuing education and training by providing education, conferences, and seminars. Discounts for such activities may also be available for organizational members. In a previous presentation, we talked about negligence and the importance of maintaining one's skills and knowledge through continuing education and training. Many professional organizations make it a priority to ensure their members have access to high-quality, accessible continuing education. Professional organizations may offer informational opportunities for education to sharpen skills, enhance management and leadership knowledge, work with computer systems and tools, or provide customer service skills. In many jurisdictions, these educational opportunities may be utilized to meet state requirements for recertification or relicensure. Within Wisconsin, flexible content is permitted at all levels but EMR for renewing an EMS license if that provider does not want to attend a formal refresher through a training center, and the NREMT mandates that EMS providers obtain continuing education to renew their NREMT certification. Webinars, newsletters, and other related resources are often utilized to keep organization members up to date on political developments, modifications in law, or emerging changes to the practice of EMS. With the proliferation of the Internet and electronic media and resources, continuing education can be satisfied in many ways, which still includes traditional classroom and lab-based refreshers. Continuing education is not only a requirement for licensure and certification renewal, but many would argue that EMS providers have an ethical and moral responsibility to ensure they are up to date on emerging changes and new techniques and practices within EMS. Many professional organizations also made advocacy a primary goal or function by monitoring changes in the law that impact the profession while also participating in political action and activities to champion for changes that would benefit the profession while arguing against those proposals that would hurt the profession or limit its expansion. For example, the National Association of EMTs reviews and monitors all federal legislative initiatives that impact EMS. Advocacy helps to connect agencies with their legislators to discuss the issues that are important to them. Organizations with a significant number of members have an inherent level of political clout that can be used to advocate for the profession and its members. Inversely, an organization may encourage its individual members to contact local policymakers and legislators to advocate at a grassroots level, which can be just as effective in some cases. The benefit of a professional organization in these scenarios is that the organization can distill the issues to clear talking points while striving to ensure a consistent message is delivered by all members of the organization to their local stakeholders, policymakers, and legislators. Another benefit to being a member of a professional organization is that larger organizations can typically leverage the size of its membership to negotiate discounts from vendors for its members. The vendors benefit by obtaining access to the organization's members, and the members benefit by receiving reduced pricing on various goods and services such as insurance, education, travel, supplies, or subscriptions. In terms of resume building, being active in a professional organization shows potential employers that you are willing to spend time to make changes while keeping current on education and skills. You are actively involved and vested in the profession, as opposed to someone who treats EMS as a job to be left on the proverbial doorstep at the end of the shift. Self-regulation and seeking self-improvement are the marks of a professional, and being active in a professional organization is a great way to help pursue professional goals. True professionals usually belong to organizations representing their interests in promoting and advancing their professions, and EMS is no exception. To clarify, an EMS provider does not need to be paid to be a professional. Volunteers are EMS professionals, just as a full-time provider with a municipal or private fire department or EMS agency. If you are providing care out in the field, the public expects you to be a professional without any consideration as to whether or not you are paid for your services. As an EMS professional, it is important to have a voice representing your professional interest, especially at the state or national level where laws are drafted that will ultimately impact your profession. Professional EMS organizations provide members with a channel for proposing improvements in the EMS system, a voice with legislators supporting or opposing legislation, research benefits, publications, a mission statement, a code of ethics or conduct, and continuing education. Professional organizations are typically also involved in conducting and/or publishing research for the betterment of the profession. The generation of mission statements, a code of ethics or conduct, guidelines for self-regulation, and suggestions for credentialing or certification are all additional benefits associated with professional organization membership. Simply stated, being involved with a professional EMS organization can help the EMS provider improve as an EMS professional. Medical publications, for instance, have a direct impact on the care provided by EMS, whether the EMS provider is aware of that or not. The better educated the provider, the better the care he or she provides. Professional EMS organizations work hard to help their membership in pursuing a better understanding of EMS at various levels with the ultimate goal of strengthening the profession and improving the quality of care provided in the field to the public. Many professional organizations are involved in the publishing of newsletters, bulletins, training materials, and even textbooks. These resources typically include information related to technical developments, research, or updates that are strongly related to those within their respective profession. When evaluating professional organizations, be sure to look at their mission statements. The mission statement of a professional organization will outline the purpose and goals of the organization, which can help an informed consumer or professional decide whether or not membership in the organization would be a good fit. By knowing a professional organization's mission statement, one can better understand the organization's values. Advocacy, support of members, and improvement in the practice of EMS are all worthy elements to be included in a professional EMS organization's mission statement. Codes of conduct or ethics commonly exceed the minimum requirements established by law for the conduct of a professional. Within EMS, this typically means defining and upholding standards of professional practice and education, maintaining competence, and refusing to participate in unethical activities. Professional organizations are private entities that function under their own unique standards, rules, and guidelines. As a result, professional organizations can revoke the membership of someone who violated their rules or professional code. If membership in the professional organization is a requirement for a job, promotion, or bonus payment, such revocation could have profound impacts on the former member. While not necessarily an organizational membership, acquiring and maintaining certifications or credentials from professional organizations may be required in some instances. Within Wisconsin, for instance, all EMS providers must maintain current credentialing in the American Heart Association's BLS for Healthcare Provider or an equivalent from another organization as recognized by DHS. ALS providers must maintain advanced cardiac life support certification, and initial licensees at the intermediate or paramedic level must also have a pediatric advanced life support credential. Obtaining NREMT is required for initial licensure upon completion of an EMS program within the state. In other cases, obtaining professional credentials such as PEP, GEMS, or BTLS are optional and are not required for licensure in the state. Whether or not an employer requires such credentials is up to an individual employer. Such credentials are also useful in building a resume, however, even if not required for employment. Maintaining such credentials can be a time-consuming process, so it definitely shows a commitment on the part of the provider to pursue continuing education and seek professional improvement as an EMS professional. Self-regulation has been mentioned a few times within this presentation, and now is as good a time as any to define what it means within the context of EMS and professional organizations. Self-regulation is when the state processes for licensing include review by a licensing board made up of the peers of the licensees, or where certification by the professional organization is a prerequisite to obtaining a state license. In Wisconsin, for instance, initial applicants for licensure within the state must obtain NREMT certification before they will be awarded a state EMS license. There may be a different process for someone seeking reciprocity to practice in Wisconsin given EMS licensure in another state. As part of the NREMT application, the candidate must self-report criminal history and can be denied certification if dishonesty in any part of the application process is discovered. This is a form of self-regulation designed to strengthen the profession by evaluating the professionalism of those who are certified by the NREMT. An integral part of this self-regulation is the professional association's practice of disciplining those who violate its standards. Most organizations have some type of hearing process available where a member can present his or her rationale for questionable actions to a group of peers prior to the organization revoking, suspending, or otherwise negatively impacting the individual's membership status in the organization. With that being said, organization membership is commonly voluntary, and organizations are not governmental agencies, which means they do not have to follow due process requirements that would apply to a public employer. Members are also not employees of an organization, which means labor and employment laws that apply to both public and private employers do not apply. For those who need to maintain membership with an organization, there is no guarantee that a due process proceeding will be available or thorough prior to a member being disciplined by an organization. Along those lines, many have expressed concerns that self-regulation can be used by members of the profession to exclude or expel people based on reasons other than competence or a violation of the organization's code of conduct or ethics. Despite this criticism, professional organizations are excellent mechanisms for credentialing and certification to recognize members who further their education and skills through a college degree, state licensure, or the attainment of some other certification. To clarify, organizations may certify individuals in various disciplines, but they do not have the ability to license people to practice within a profession. Licensing for the purpose of providing pre-hospital care to patients falls solely on the authority of the appropriate state agency, such as Wisconsin's Department of Health Services. As having a state-issued EMS license or certification, depending on the state, is typically a minimum hiring requirement, professional organizations routinely assist their members in obtaining training and credentials beyond their state-issued license to practice. Each profession typically has several different organizations that profess to represent people within the profession, and EMS is no exception. There are numerous organizations at both the state and national level that serve EMS professionals, although they typically do so in different ways. Keep that in mind when deciding on what professional organization to join. Ultimately, a professional organization is only as strong as its membership, and your participation will add to the depth of that organization. Make sure the organization's mission, vision, and goals align with yours before joining. As far as professional EMS organizations are concerned, we'll begin a quick overview of some of them at both the national level as well as some unique to Wisconsin. The National Association of EMTs is dedicated to expanding EMS knowledge and education, enhancing professional development, and advancing the cause of EMS through advocacy and research. The National Registry of EMTs provides instructors with an avenue for becoming an instructor and affiliating with an organization that strives to promote the best EMS education and the idea of lifelong learning. The National Association of EMS Educators seeks to inspire and promote excellence in EMS education and lifelong learning within the global community. The Continuing Education Coordinating Board for EMS provides a set of standards for EMS education. The National Association of EMS Physicians is a resource and advocate agency for EMS physicians and other EMS personnel. The American College of Emergency Physicians serves the needs of the emergency physician in communities also serviced by EMS providers, and many hospital emergency departments require their EMS physicians to be ACEP certified. The International Association of Firefighters EMS section is a group for firefighters to join in order to promote EMS in the fire services. The National EMS Management Association is a professional association of EMS leaders dedicated to the discovery, development, and promotion of excellence in leadership and management in EMS systems. The National Association of State EMS Officials supports its members in developing EMS policy and oversight, as well as in providing vision, leadership, and resources in the development and improvement of state, regional, and local EMS and emergency care systems. The association also provides a list of state EMS offices on its website. Many states have regional offices that provide direction and resources for local EMS providers, and members of the provider agencies can participate at that level, influencing what happens at the state or national level. Within Wisconsin, there are several professional associations that impact EMS within the state. While the Wisconsin EMS Association is probably the most prominent, the integration of EMS into the fire service within the state also makes organizations like the Professional Firefighters of Wisconsin, the Wisconsin State Firefighters Association, and the Wisconsin State Fire Chiefs Association important players in the EMS political landscape within Wisconsin. In contrast to a professional organization that is a group of individual professionals who self-regulate, a trade association is a group of business organizations that join together to promote their mutual interests. Thus, while you as a standalone EMS provider may join a professional organization, your EMS agency may choose to be part of a trade association. Trade associations also engage in advocacy and providing continuing education. They may also provide certifications for their members along with a venue for their members in which to network. The American Ambulance Association is probably the most well-known EMS trade association within the United States. Its mission is to promote healthcare policies that ensure excellence in the ambulance services industry and provide research, education, and communications programs to enable its members to effectively address the needs of the communities they serve. The most predominant EMS trade association in Wisconsin is the Professional Ambulance Association of Wisconsin, which considers the promotion of excellence and quality in Wisconsin's ambulance industry to be its primary purpose. PAW was started in 2005 and has numerous EMS agencies from across the state as members. Another type of professional organization is an accrediting body. Accreditation is a process by which industry-wide gold standards are applied in the evaluation of a business or entity, such as a fire department, police department, or EMS agency. Those businesses or entities that meet this high standard, which often exceeds those established by state or local regulation, may advertise themselves as being accredited, which is a testament to the organization's dedication to quality within its profession. Accreditation is very common in higher education, and it is an emerging standard for many protective service agencies. It is not easy to become accredited. The process is time-consuming and also comes with a financial cost. Services must apply for accreditation, conduct a self-assessment, have an on-site evaluation by the accrediting body, and correct shortfalls identified by the accrediting body before obtaining accreditation. With that being said, accreditation can be used to assure your local officials of the quality provided by your EMS agency. It also helps legitimize your agency within the medical community, which is very familiar with their own accrediting bodies, such as the Joint Commission, which accredits healthcare organizations such as hospitals, doctors' offices, and nursing homes. The Commission on Accreditation of Ambulance Service Standards are designed to increase operational efficiency and clinical quality while also decreasing risk and liability for the organization. Another accrediting agency is the Center for Public Safety Excellence, which promotes the continuous quality improvement of fire and emergency service agencies that serve communities by providing training and career resource information. According to the Commission on Fire Accreditation International, the CPSC accreditation process provides a well-defined, internationally recognized benchmark system to measure the quality of fire and emergency services. The Committee on Accreditation of Educational Programs for the Emergency Medical Services Professions advances the quality of EMS education through accreditation. Given parallel philosophies and goals between the COAMPS and NREMT, the NREMT will not examine paramedic students who do not graduate from COAMPS accredited programs, and within Wisconsin, DHS 110.22 requires all paramedic programs within the state to be accredited by the COAMPS. There is even an accreditation body that validates the quality of not only ground ambulances but aeromedical services as well. The Commission on Accreditation of Medical Transport Systems is dedicated to improving the quality of patient care and safety of the transport environment for services providing rotor wing, fixed wing, and ground transport systems. The International Academies of Emergency Dispatch is a standard-setting organization promoting safety and effective emergency dispatch services worldwide. Recognition as an accredited center of excellence by the IAED is proof of the dispatch center's efforts to provide superior, up-to-date public care and efficient resource utilization to achieve maximum results in emergency situations. Whether you are a new EMS provider at the start of your career, The experienced provider looking to expand your professional horizons, or an EMS leader within your organization who is frequently asked for career advice by others, it is important to recognize the impact of professional organization membership and involvement on an EMS provider's career opportunities. When evaluating the different options available, consider how a professional organization or trade association may enhance an individual's professional reputation, provide an avenue for networking, and provide continuing education, especially if your state requires continuing education for relicensing purposes. In addition to nationwide organizations, also consider local or regional associations, which often have a more direct impact on the profession within your state or area. Joining a professional organization or trade association benefits not only the member, but EMS as a profession on the whole. After all, an organization is only as good as its members. In summary, the professional organization serving EMS promulgates standards of excellence for the EMS provider in the form of initial training, testing, and recertification. Organizations providing accreditation intend to establish the highest level of service with all elements necessary for providing that service. All organizations that the EMS provider considers for membership will have somewhat similar characteristics or activities such as self-regulation, discipline of members, declaring a mission, publishing newsletters and white papers, and providing guidance. In addition to professional organizations, EMS leaders should consider the benefit of having their EMS agencies become members in trade associations and accrediting bodies. Ultimately, regardless of the professional organization chosen, it is important for the EMS provider to be as active as possible within the organization to maximize the potential benefits associated with membership in the organization.